Good afternoon, ladies and gentlemen. Let me present to you my PhD topic, which is the role of knee injuries in the development of osteoarthritis. My name is Miklos Máté. I'm a fourth-year resident at Uzsoki Street Hospital. My vision and mission haven't been changed since the first time I started this program. I would like to have decision-making for the daily practice and to have a more clear picture about post-traumatic osteoarthritis. Here you can see my three projects. All of my projects, we are investigating ACL injuries and the development of post-traumatic osteoarthritis. My first project was a meta-analysis, and we were about to see the changes of the osteoarthritis signs after ACL injuries. We compared two treatment type, the ACL reconstruction and the conservative treatment. ACL injuries are one of the most common sporting injuries, which mainly affects young and healthy populations. Almost 130,000 ACL reconstruction made yearly in the US. And the prevalence of osteoarthritis in recent studies in 10 years is 50 to 90%. Although the superiority of surgical treatment compared to non-operative is low, and also the progression of articular cartilage degenerative change has controversial results. Our aim was to analyze short-term osteoarthritic evolution, injured versus surgical versus conservative treatment. Our patient population was the patients with ACL rupture, and we compared surgical and conservative treatment, and our outcome was about to see the development of osteoarthritis. Here you can see we made a search key and we found more than 2,000 articles, and 13 articles was synthesized by us. Some words about the knee osteoarthritis outcome score. This was the only outcome score which we could synthesize. It is a patient-reported joint-specific score which assesses a patient in 5 scales. 0 indicates the worst possible, and 100 indicating the best possible scenario for the patient. Comparing, here you can see my first plot, and this is the only result which has which hasn't got a significant difference. The KOOS quality of life score favors the surgical treatment. The other 4 subscale, the pain, the symptoms, the function in daily living, and the function in sport and recreation hasn't got any significant difference between the two treatment type. We also made a table from the one Canon study, which was about to see the different MRI pictures. It has some interesting findings. The different measurement tools with the same population has different results, but the most important finding here that the early cartilage defects were clearly visible after 3 months compared to 5 years. Here you can see the strengths of our study and also the limitations. We have to see that we only have 2 RCTs. There wasn't any comparable radiological outcome, and the main issue is that high variety of grading system what the authors use. This is why we only can make from 2 RCTs. In conclude, young active adults, strategy of ACL reconstruction doesn't provide better patient-reported outcomes at 2 years. And also it is interesting that the structural changes appear early after ACL injuries. Implication for practice that conservative treatment based on these results could be considered. but we have to advise to the authors to have more randomized trials and to have a standardized protocols and populations. Here's the status of our manuscript. My second topic is a prospective MRI follow-up study. We would like to see the early signs of post-traumatic osteoarthritis, and we have chosen the isolated anterior cruciate ligament tears for that. About the background, only limited data exists for isolated ACL injuries, but in the recent studies we can see that it has cartilage deterioration after isolated ACL injury. Also, more than 80% of the MRIs after that injury, subchondral edema present. And also, this initial bone bruising could affect the chondral changes. And there is another study which says that bone bruise is a significant factor for the early degenerative changes. We selected patients with isolated ACL ruptures, and we comparing the injured knees versus the contralateral healthy knees. Our clinical question is that does ACL reconstruction decrease development of osteoarthritis, and also another question is that the transtibial tunnel positioning affects on the development of osteoarthritis. Our clinical implication here is to understand early osteoarthritic changes in post-traumatic knee. Here you can see our general eligibility criteria, what we use, and also our outcome, and what is the purpose of that is to see the early signs of osteoarthritis. We use a specific MRI sequence for that. It's the T1 row mapping, which can see the chondrocytes itself, and we are going to investigate the proteoglycan depletion after this ACL injury. And also we would like to see the bone marrow extension compared with this proteoglycan depletion. The secondary outcomes are questionnaires and the so-called IKDC and ICRS questionnaires, what are gold standard after post-traumatic or knee osteoarthritis. The third project, which actually was our first one, is the role of anterior cruciate ligament reconstruction in the development of osteoarthritis in less than 5 years and after 10 years. 2 years ago, we investigated with the same eligibility criteria patients with isolated ACL injury and the contralateral healthy knee, but we used a more accessible X-ray. The hypothesis was also the same what we are investigating that ACL reconstruction is chondroprotective. And we would like to see the post-traumatic, whether the post-traumatic osteoarthritis appears on X-ray early and late after the injury. As I mentioned, it was a retrospective study. We used a special view. It's the Rosenberg view with a 45-degree banded weight-bearing view, and we were evaluating the images with the Kagran-Lorentz grade, and also we measured the joint space narrowing, which were measured in millimeters. I'm not going to go through all the results, but the interesting thing is that also in the less than 5 years and more than 10 years group had a significant lateral joint space narrowing. I have to say that we when we try to standardize the population, we have chosen patients with an indirect injury mechanism, and it was an indirect valgus mechanism. Maybe this is the reason why we see early and also late lateral joint space narrowing after the injury. In conclude, that even in less than 5 years, symptoms of osteoarthritis appears, and even though we would think that ACL reconstruction may be contraprotective, considering the development of osteoarthritis, these studies also point out that our this is not really the fact. So here is an overview of our studies, ongoing and almost finished studies. And lastly, I would say that it doesn't matter how slowly you go as long as you do not stop by Confucius. Thank you for your attention.
Thank you very much for your very nice presentation. I have just a question, which is maybe I see some contradiction in between the two researches what you are doing, because the first is saying that there's no significant difference about the outcome after the ACL rupture if you do a conservative treatment or surgical treatment. So it means for me that but in both cases there is the same possibility to have an osteoarthritis later. And the second one is saying that you just made a research about what happens if you do an surgery after the ACL rupture. So it means that you are just researching if the surgery itself is a factor for osteoarthritis or not. But if you say that it doesn't matter if there is surgery or conservative treatment, so the outcome is, well, it's not a big difference significantly, if I understand well, then if it is, the question is if it is the surgeon who is developing the osteoarthritis or the ACL rupture.
Yes, thank you for your question. First of all, about the meta-analysis, as I said, it was 2 RCTs. And we just previously discussed with Professor Sandri that we cannot saying evidence about two RCTs because it's just a finding. The main issue, as you're saying, that it's the ACL injury itself, the high impact direct or indirect injury, which making bone bruises, and this is what can cause later osteoarthritis. So yes, it was just before an option that some authors say that after an ACL injury, when we reconstruct it, it could be contraprotective. Now it's almost an evidence that it's not true. The fact is that whether you reconstruct or not, it's going to be cause osteoarthritis. What we want to know is that could we see early after the injury and also the reconstruction that where is the arthrosis go through, and could it be happens because of the subchondral edema and also the little chondrocyte depletion, what we want to see at the MRI study. So yes, to answer it, the main issue is the injury itself, not the reconstruction, or not that we are reconstructing the ACL. Yeah, thank you. Okay. Sorry, I don't know if I understand what you asked, but maybe it was a little bit too widely.
Yes, I totally agree with that. Yeah, the question is that maybe you can just search that if there is a different kind of osteoarthritis which develops after the ACL reconstruction. I mean, patellofemoral or medial side, and maybe we can make you can make some kind of differentiation if there is.
Yes, this is another good point, that we also investigating indirect mechanism of the injuries, and as we find out with the X-ray study that it was a lateral joint space narrowing. Later with MRI, when we can objective it, when we have an objective way to understand where it exactly the issue is, it could be seen and make some data for that. Where is it really the issue is?
Yeah. Even if we are out of time, but it's a very interesting topic. So I would also raise a question for you,
yeah, sure.
And that is that how was the age in years in this patient cohort? Because you know, you mentioned that high energy trauma, but we know that in elderly patients, it's a small energy trauma can also also can cause a rupture of the ACL.
Yes, thank you for the question. This is why we are making our eligibility criteria 18 to 35, and also we are this Tegner activity score indicates population which are active. So higher BMI is also an exclusion, but this Tegner score makes it through that these patients are an active patients. 10 means that professional sportsmanship, and 5 means that is a hobby sportsman. So this is why we try to make the standardized population also to have patients with good muscle strength and stuff like that, and what you were mentioned, Professor.
And the second question, that the type of operation was the same in
yes.
every patient?
Yes, exactly. These patients are our patients. We are making the transtibial positioning. We are making single bundle ACL reconstruction with hamstring graft. So this is why I'm saying this is a standardized thing, because we try to put everybody into the same little I don't know how to say. So we try to really have a standardized population with the same operation we have.
My last question is that it's less than 5 years and more than 10 years. But less than 5 years, that it means that it can be 1 year follow-up.
Well, the last was the last was 2 years, and it was really hard to find patients who has these options, that contralateral Helsinki, isolated ACL injury. So this is why we choose the 2 to 5 years, because.
Okay, thank you very much.
Okay.
Thank you.